drain. But this does the central part of the lower lip, the central part of the mandible, and under the neck. And there's a little submandibular, which is sort of more out to the side, and it's lying on the submandibular gland. So that big old salivary gland that you sort of carved off when you went on the outside, there are actually nodes lying on top of it. This is going to drain the submental ones and many areas along this whole side of the face, because this node is coming down into there, part of the lips, part of the gingiva, and part of the tongue. And even more retropharyngeal, sort of deeper back into the throat, in the retropharyngeal space, which we'll talk a little bit more about next week, which drains the area in the back of mainly the pharyngeal area, right? The area of the posterior nasal cavity, the nasopharynx, the soft palate, the middle ear, all that deep area down in the deep face goes off usually into this retropharyngeal node right there. And then there are more nodes down on the front side. So this pretracheal, prelaryngeal, and infrahyoid. So down here in the front, the laryngeal area where we were dissecting yesterday, or I guess Wednesday, there's lots and lots of nodes lying around the larynx and the trachea, as well as the pharynx and the esophagus. So the whole deep neck area. Okay, so specific problems, specific areas where, if there are infections of one sort or the other. The lips can drain down into these submandibular areas. The gingiva also, so the gums, can drain into the submandibular areas, and then they'll work their way down to these deep cervicals. Or they can go anteriorly into this submental, particularly the area of the lower lip and the front teeth can drain down into there. Teeth, again, maxilla, interestingly enough, the maxillary teeth up here are draining down into this submandibular node through the infraorbital canal. So they drain from up, they go through the infraorbital canal, then come down into here, or go backwards into there. The mandibular teeth drain through vessels in the mandibular canal, right? So you've got these arteries, veins, nerves traveling within the mandible itself, and these mandibular teeth drain through there into the area back here in the back of the mandible, right where you see the mandibular foramen, and then they end up in the deep cervical chain through here. So they tend to flow, lower teeth tend to flow backwards and out there. The tongue is unbelievable. Retropharyngeal, the posterior part of the tongue drains back into the retropharyngeal area. No surprise. Okay. Middle part of the anterior part of the tongue can drain into deep cervical. Okay, the middle of the tongue. And then the lateral part of the anterior part of the tongue drains out to these submandibulars down here. Okay, so basically the tongue, which seems like a simple unified structure, has drainage in many, many different areas. And I think in the front part, the tip of the tongue area in the front is draining down into these submental. So there's sort of obviously a geographical distribution. Right, so here's the tongue, the back, let's show you. The back part of the tongue, okay, is draining posteriorly into the retropharyngeal nodes. Okay, so the area back behind the pharynx. The middle part, the central part of the tongue, is draining into the deep, well, they're all going to end up in deep cervical eventually, but it drains directly into the deep cervicals. The lateral parts of the front part of the tongue are going to those submandibular nodes, and the anterior tips going into the submental nodes. So realize the tongue It drains in many, 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 many different directions. So cancer of the tongue can have stuff spreading all over the place. Okay, so all of the tongue except these parts, so the lateral parts are obviously going to the lateral nodes, but the front part, the middle part here, and the back part, they can go to either right or left. They're not as evenly divided. The edges are going, the left side's going to the left nose, the right side's going to the right nose, but the middle nodes can go in either direction, not surprisingly. Okay, so as I mentioned earlier, when there's cancer spreading to these deep cervical nodes, surgeons often do a radical neck dissection, so they'll pull out sternocleidomastoid, get out all those nodes, and strip them out as best they can. Okay, needless to say, I don't expect you to memorize all that, but you should have a handle on the major patterns and, deep cervical nodes. That's the bottom line. And should you ever want to look it up, now you have a reference. Okay, this is our schedule, so we have it written down. Monday, I asked it on last lecture, said that we could staff the lab on Monday afternoon if any of you feel inclined to come in and review stuff after your biochem exam. And people raise their hands, and do people still plan to show up? Okay, we won't have full staffing, but one of us will be there from 1 till 4-ish or so. So one will be there for a couple. We'll have somebody there in case anyone wants to go over stuff with us. Tuesday, we have a lecture in lab on the ear. The ear doesn't take a whole lot of time. You sort of put the chisel in the internal acoustic meatus, hit it with a hammer, and hope for the best. And sometimes you find something, and sometimes you find less. So we will also, we haven't followed up much on the lower limb because it wasn't on the last exam, but we'll have the lower limb parts dissected and pins and everything for you to look over. What we're going to do by Tuesday is we will have a list of 15 or 20 or so structures of the upper limb and lower limb that you're responsible for. Since you didn't have a formal dissection with structures in bold, we'll give you a list. And maybe we'll go around and put some pins in them just so it'll be pretty straightforward. Also Tuesday, just to get you back in the swing of anatomy after your other exam, we're going to have a short quiz because this lecture in lab's relatively short. So at the end of the lecture, we will have a quiz, which we will grade. Well, we will correct. I won't say we'll grade, but we'll look at it just to see how much you guys remember by Tuesday. Okay, Wednesday is a normal class. There will be a lecture, and there will be a lab quiz when we go in on Wednesday. Just again, get you into the practice of taking lab exams. Otherwise, there's no assigned dissection on Wednesday. It's an open review. We will be there and to answer questions or go over stuff with you. Nothing on Thursday because you have your other course. Friday is another open review. And I think we might also do some pins before you come in just to keep reiterating that because there's a lot of structures. This is a cumulative exam. And some of the stuff you might not remember as well as you should. So we'll do another set of pins, which again, we can talk about and go over. Saturday, there is an open lab. Dr. Fernandez will be there to answer questions, reassure you, or whatever he needs, from 1 to 4, if you want to come in then. Monday, there is a final exam. The lab part will be first, and then we will go to our usual, I believe, lecture hall 5 for the written part. Tuesday, there is the optional tooth extraction. Dr. Cuisine will come in and explain how you pull teeth, and then you can practice under his supervision on the cadaver, on not only the cadavers in our lab, but also the medical school will be through. The medical cadavers will be through. Their lab exam is Monday, so they'll be taking the written on Tuesday. So there's 35 or more cadavers over there. So there's plenty of stuff for people to work with. Yes, Colin?
What time is that?
Well, that's an interesting one. Dr. Cuisine said he wants to make it early because he has something else in the late afternoon. So he said he would like to give you a short talk at noon. And then he says that's 30, 35 minutes, just shows you the equipment, tells you how you do this, that, and the other. And then from 12:30 till 2:30 or so. He will be available to help you in the lab, and then he has to go away. Okay? Yes?
For the final,
Yes?
is there like a general breakdown of like how much is going to be from this new stuff versus how much is going to be from other stuff?
The general is about half and half. And I will tell you that the last exam, the part that was covered in your last exam, exam 3, go over that really well, because there was some indication that people really didn't learn that. So there will probably be some questions from that exam that will look, on this exam, that look very familiar. Just to make sure that the stuff that you were supposed to have learned last module you actually did. And then we'll pull bits and pieces. Well, the skull sort of blends in. I mean, you know, the holes and processes are obviously, we've been talking a lot about recently, and then the thorax and abdomen will get proportionally less. Yes, you.
Is there going to be an emphasis placed on that which we were already tested on? Meaning,
There will be some of that, yes, particularly for that last module, the one before this one. You might see some familiar questions. Yes?
For the lab also, what percent will be?
Again, it's, you know, about half and half. Although I would think this last bit, about half and half. But again, you know, that the older half will, again, have a lot of module 3 in it. But there seem to be some issues there. Yes.
40 pins also?
What? No. We're gonna ramp that up to probably 60 if we can figure out a way to do it.
I guess my body with no head. I guess my body with like no.
Well, you know, we can like put a pin in the table and say what should be here, just to see if you know the overall. There are also, you know, we can put skulls on there. We can put a loose foot on there. There's lots of ways of filling up that table. Yes, Ansel.
For the quiz, should we start studying cumulative stuff?
No, the quiz is the last couple of
Just the last one.
last couple of weeks from the time, I guess, what we pull the head off, I guess, onward. Yes, again. What?
Extra credit?
We might find room for some extra credit, which means there'll be a whole lot of questions for this exam. Yeah? Are you happy?
I was stretching, but I actually do have a question.
What a coincidence, okay.
Are the pins worth they're worth less than what they used to be worth, right? Because if there's more of them, then
Per
it's
pin,
worth-
yes, but
yeah.
the lab exam will still be 40% of the final exam grade, of the 40% that this exam takes. So actually it probably balances out about the same, because this exam counts 40% of your grade, whereas the other ones counted less, 20 or so. Yes?
Would the extra credit be on the written or the lab or both?
Could be anywhere. Any other questions? Okay, so good luck in finishing off that other competitive course. We'll be happy to have your full attention for a change. And we'll see some of you Monday afternoon and all of you Tuesday. Have a good weekend.
My chemistry professor, undergrad, with extra credit question. What is my favorite pie?
No way.
And we would talk about it during class. There we go. Someone can bring something up. Like if someone says something, be like, how many grandkids do I have?
That's
Let's talk
so
about
funny.
grandkids. So those were like, there are 2. Kind of unfair. Well, I think they're extra credit, not like. Right, but.
Yeah, no, exactly.
Yeah. But you can imagine that being part of the regular test. Like it's like something coming out. Like wait to have whatever I was getting like the next week. So was everyone writing down like all this random stuff after?
Whatever, blah, 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 it's in my grade now. Like, I have all of them for right now, and then I still have like another 2 grades.
Nice gray on gray, Tony.